How to report appropriate EM level for ED patient with exacerbated chronic illness. Question. A 19-year-old male with asthma who experienced wheezing and shortness of breath for the past 2 weeks presented to the emergency department ED. Inhaler use 10 to 14 daily offered temporary relief. Physical exams were normal except for tachycardia, scattered wheezing breath sounds, and elevated respiration. The physician completed 3 tests: complete blood count with differential complete metabolic panel, influenza A/B, respiratory syncytial virus, and COVID-19 polymerase chain reaction panel, gave the patient a nebulizer treatment and steroids, released him with MDI and steroid burst, and referred him for a follow-up visit with his doctor of primary medicine. Which captain code would be reported for this visit? Answer. This scenario fits quite neatly into the requirements for Captain Code 99284 ED visit for the EM of a patient, which requires a medically appropriate history and/or examination and moderate level of medical decision-making (MDM) according to the American Medical Association's ED-MDM grid. The patient has a chronic illness with exacerbation, which is a moderately complex problem. The physician ordered 3 tests and reviewed those results, which supports a moderate level of MDM. Then, the physician gave the patient a prescription drug, which also supports a moderate level of MDM. This encounter, therefore, would be reported using Captain Code 99284 for an ED visit. When coding ED visits, if the provider sees a patient with an exacerbation for a chronic illness, coders should make sure that he or she documents whether the exacerbation is severe. That documentation is going to be the differentiation between moderate and high complexity for the problems addressed.